Hello, all. Thank you for joining us today. My name is Liv Sasaki, and I am the Executive Director in Utah of the American Heart Association. It's my pleasure to welcome you to the American Heart Association's community conversation about women, life stages, stress, and your health, sponsored by Cambia Health Foundation, corporate foundation of Regence Blue Cross Blue Shield Health Plan. Before we start, a quick note for our audience. You will notice a Q&A icon in your menu. This is where you can share your questions. If we don't have time to cover all of your questions during our time together, we will plan on following up in an email. Since this is a webinar, you won't need to worry about mute, unmute. We invite you to stay engaged in today's conversation by typing your reactions and thoughts into the chat. At this time, I'd like to introduce you to our moderator and panelists. Our moderator today is Kim Frost, Public Affairs and Government Relations Director for Regence Blue Cross Blue Shield of Utah. Kim is currently on the Make-A-Wish Utah Board of Governors and serves as the chair of the State Air Quality Board appointed by Governor Cox. She also serves on the Policy Council for the Children's Center of Utah and volunteers as a court-appointed special advocate. She holds a Bachelor of Arts degree from Utah State University in Political Science. Welcome, Kim.
Thank you.
Our first panelist, Lindsay Buttram, is a Policy Implementation Manager with the Policy Project. Before joining the Policy Project in June of 2024, Lindsay received her Master of Public Health degree from the University of Utah, focusing on community health. There, she served on the Student Advisory Committee, was inducted into the Delta Omega Public Health Honor Society, and received the Division of Public Health's Community Engagement Award in recognition of her community advocacy and service work. She is passionate about improving the health of Utah's communities and using evidence-based approaches to foster systemic change. Welcome, Lindsay.
Thank you for having me.
Next, I'd like to welcome Patty Cook. Patty serves as the Director of Communication and Marketing with Women's Leadership Institute. She has also been involved in local community outreach and advocacy efforts. As a WLI's Political Development Series graduate, Patty testified with the WYCA on Utah's Capitol Hill to help secure increased funding for maternal mental health. Patty is passionate about education, advocacy, and women's issues, especially the intersection of women and the workplace. She has a BA in English Sociology from Brigham Young University and a Master of Professional Communication from Weber State University. Welcome, Patty.
Thank you.
Our final panelist is Dr. Susan Madsen. Dr. Madsen is the founding director of the Utah Women and Leadership Project and is leading a statewide social change movement titled A Bolder Way Forward. Dr. Madsen is considered one of the top global scholars and thought leaders on women's leadership, has authored or edited 9 books, and has published hundreds of articles, chapters, and reports. Her research has been cited in multiple national publications, and she is a regular contributor to local and state newspapers. Dr. Madsen is the professor of leadership in the John M. Huntsman School of Business at Utah State University and serves on many nonprofit and community boards. Welcome, Dr. Madsen.
Great to be here. Thanks.
Thank you all for joining us to share your expertise today and engage in this important conversation. Kim, I'll turn it over to you.
All right, wonderful. Thank you. I'm really excited about having all of our panelists here today. They have such a wealth of knowledge that I think it's going to be a great conversation. So to kick it off, I'm going to ask kind of a general question just to kind of set the stage, and I'm going to let each one of our panelists answer it. We know that about 60% of caregivers in the sandwich generation are women, which frankly, I expected it to be even higher than 60%. And that's according to the Pew Research, and they spend an average of 45 minutes more each day on caregiving tasks than their male counterparts. So as the population ages, what are some emerging or unique stressors that these sandwich generation of women are experiencing? And I'll go first to Dr. Madsen.
Great question. We actually just a few months ago released a brief specific on to women and aging. So we think of especially 50 and above. And so some of the categories we really highlighted, and the research outlined that really affect women as they age, is still the caregiving And sometimes grandmothers take care of their grandkids, but often it could be partners. It could be, elder care in different ways, parents and so forth, but also help. Just women as we throughout, can I just say that throughout the lifespan, right? We have unique health issues, whether it's reproductive years to perimenopause and menopause to older years as well. And then I'll just mention, I mean, from the latest research that throughout the lifespan, older women and women of all ages really struggle with mental health challenges and dementia, of course, when you get older. And in Utah, we're actually seeing older women really starting to struggle even more, especially if a spouse has passed or they don't have a partner, with affordable health or affordable housing. So we think that wouldn't be the case, but I'll tell you, we're finding in the literature that that's really a concern. And one more quick thing, in terms of our reports on poverty, we're actually third best in the United States. Utah is, but for women, if you're two categories, one, if you're a single mother with young kids, and two, if you're 70 and over, there's some real problems with in some cases homelessness, but poverty for sure. So those are a few that come to mind.
Yeah, thank you, Dr. Metzen. Patty, did you want to add to that?
Yeah, thank you. So we both go in and talk to CEOs of organizations at the Women's Leadership Institute, and we also have hundreds of women come through our cohort. And so my answer might be surprising, but I actually would say trauma responses. Because as women, whether they have kids or not, and they're coming up in their careers, they manage it pretty well. Like there's resources and they're managing it pretty well. But then you also put on caregiving of elderly parents or, community members or what, and they really are pressed. So their coping skills and things that they might have been managing up to that point, they now need additional. And right when they're so busy and so stretched is a time that they really need to just pause, do self-care, do some work, right? Many women in this 60% that you talked about also are relooking for purpose and how do I engage where I'm at now with the resources and who I am now. So those two things are things that we have seen in our work with the women in the workforce.
Yeah, that's great. Thank you. Lindsay, I'll turn it over to you for maybe a final thought on this.
Yeah, I think both Dr. Metzen and Patty had some good points. And I think as I personally am getting into this phase of life, there are challenges. And I think to Patty's point about the need for stress and addressing trauma, I think this is an additional challenge for women in this particular phase of life because we are often not prioritizing our own self-care, as Patty said, and there aren't particular resources that are targeting our mental health and these needs, I think, for additional supports. Balancing, as you leave a time where your primary caregiving duties may be focused on your own children, and then you start to add in as Susan mentioned, caregiving responsibilities for grandchildren and then elderly parents. That is a lot of stress. And I personally have not felt the additional supports that are needed to manage that stress. And I do think that that is a particular challenge for women in this particular phase in life.
Yeah, absolutely. Thank you. Well, I will start with my first question, and maybe this time I'll turn I'll turn it around and ask Lindsay. I'll start with Lindsay. So Lindsay, based on your experience with evidence-based approaches to community health, what policy changes do you think would be most effective to reduce stress burdens for Utah women?
Yeah, I think this is a great question. So one of the clearest lessons I think I've learned through my work with the Policy Project, where we look at, policy solutions to different challenges, is that the systems level upstream change is essential to improving outcomes, including health outcomes for families and individuals and in communities, which I'm very interested in. And I think what's even more important is that system change can catalyze culture change. And ultimately, that's what we need to have that lasting, widespread impact on the lives of Utahns. And I think one of the most impactful ways that we can reduce that stress and make that culture change is to look at how we approach childcare and caregiving at the policy level. We know that like a third of the US workforce are parents to children under 14. So this is a challenge that many people face. We know that affordable and accessible childcare is very foundational. And we also know that when women in particular have childcare options for their children, it can reduce economic and emotional strain. So if we're looking at a solution that can really impact the lives of women, I think looking at childcare solutions could be extremely beneficial. I think, wouldn't it be wonderful if we lived in a world where families are making decisions on employment and childcare based on their desire and not their necessity, right? If we could choose to stay at home and maybe be a primary caregiver, if that's what we want, and that option is accessible to all families, or we can choose to be in the workforce, or have a combination of the two, that those choices are dictated not by, necessity and financial need, but by just personal desire and the family's choices. And I think there are some things that can get us closer to that point. I think we all understand that that is a big ask, but there are some things, and I think one of the first, looking at the culture change piece, is that we treat childcare not as a private burden, but as an economic infrastructure solution. Childcare isn't just a personal family issue, it is a workforce issue. And we know that, 1 in 5 parents in the US have had to reduce their hours or leave jobs due to inadequate childcare. So this is affecting, companies, organizations' bottom lines. And in Utah, this to me was really shocking to when you think about it. But we know childcare costs are actually exceeding in-state college tuition. So think about the inaccessibility of college
Wow.
tuition to many families. And so if you think about that, and that it's actually about $5,700 annually more than in-state college tuition to provide full-time childcare. So many families are spending a large portion of their income on childcare. And so when it's inaccessible and and unaffordable, we know that disproportionately women are impacted. And so I think there are definitely some solutions that can be addressed looking at policy to try to drive those culture changes, to be able to support women and their choices.
Yeah, absolutely. Thanks, Lindsay. That was great. I'm going to maybe go to Dr. Madsen and just ask kind of a follow-up question to that. Lindsay talked a lot about policies that would be helpful. And I know you've done a lot of research into like organizational changes that could be made within businesses. What are some of those that you've found most helpful within kind of organizations?
Well, definitely Lindsay's said it all about childcare. Well, there's a lot more to say about childcare, but she did a wonderful overview on childcare. And actually, that is one of the most pressing issues right now for Utah families, which is not getting addressed very well in our state. Yet every one of 29 counties that I've physically visited in the last couple of years and facilitated conversations, every single one, that was one of the top things of their concerns on the list. Another one is the pay gap is one of the biggest issues here in the state of Utah, as we continue to be ranked as the state with the biggest pay gap between men and women. And people often excuse that, and it's a complex issue, but there are some policy recommendations or policy, in fact, at the Utah Women in Leadership Project, we have extensive research on policies that all states do on most of these issues. And then I would say leave policies. So family leave, medical leave, there's leave policies that we can do better at in the state. The great thing is some of the companies that are the leading companies in championing women, and families, I should say, not just women, these are family issues, right? They are leading the way. There's not public policy in many, but many of them have just said this is good practice, and many global companies as well. So those are 3 areas, but there's other areas as well. But those are the 3. Wait, one more real quick.
Yeah.
I just remembered we have one more report, and that is on sexual harassment and some of the general gender-based discrimination. So each of those 4 areas, we actually have reports. They're a few years old, but what we did was go to every single state in the nation and figure out what they were doing on these so that we could bring together some best practices for legislators and lobbyists and other folks that are just passionate about making change.
Yeah, thank you. That's wonderful. I've got a question now for Patty. So Patty, you've done a lot of work on maternal mental health, and I'm wondering what communication strategies you've identified for women when these everyday stress has crossed into the territory that threatens both well-being and also their effectiveness of being caregivers.
Yeah, this really speaks to that 60% too that we were just talking about. So this is a great question because the question really gets at when is that turning point, right? Because we all have stress, we all manage stress. Stress comes from our work, our kids, whatever our life holds for us. That turning point from my own experience and the women that I have worked with is when you start isolating, when you start feeling shame, when you start comparing, when you don't want to tell other people about what's happening, when it just seems like it's overwhelming and too much and you don't want to share. One reason I am a big advocate of people sharing their stories, especially the ones we sometimes try and hide, is because there is power in naming something. I had no idea. I had prenatal depression and I had never even heard of that. So people would congratulate me on having a child and all I could do was cry. I had no idea there was even a thing. No one in my family, no one that I worked with. I'd heard of postpartum, but prenatal, like what was that? So I really encourage women to share their stories all along that. That is an imperative. Find a trusted friend, a partner, get on an anonymous, website, whatever it is, even just writing it out to yourself. And because in naming it, we can help elevate each other. 75% of us admit to having a hard time in high stress conversations. And that's an imperative. Like if you're in a spot like that, it's okay to be uncomfortable. It's okay to be uncomfortable because it's going to be uncomfortable because what you're dealing with is bigger than your coping and everything you've learned. And that's growth, right? So of course it's going to be uncomfortable for a while, but please reach out, find community, find belonging. If anyone on this call is in an experience like that, where you're isolating or having trouble, please reach out to me. I'm happy to have a conversation and direct you to resources that can help you.
Yeah, absolutely. I think, as we prepared for this conversation, we talked about how we wanted everyone to walk away feeling like there was community and that they are not alone and that they aren't isolating. And so thanks for bringing that up and really shining a light on that. Lindsay, I was going to ask you have worked, in youth programs, you have medical education, and you've been a community advocate. How can we better connect these kind of siloed systems to create more integrated support for mothers experiencing chronic stress?
Yeah, you're right. I think, my background is a little, can be viewed as disparate. I see the thread connecting it, personally, but I have had some different experiences in my professional career. And particularly when I'm thinking about, I worked in graduate medical education, which isn't like a common job that most people understand, but in looking at how physicians are trained, and in particular, I worked with primary care physicians. And I think there are so many demands on our medical professionals to treat our individual health, right? I like to look at community health personally and think that there's great impact in addressing those things. But individual health is a critical component of that. And I think that it's important that our medical education and education for providers go beyond that clinical knowledge. And that it includes training in things like social determinants of health, for example, like looking at how chronic caregiving stress, financial strain. We mentioned the gendered expectations or gendered impacts to workplace, mental health, how those can impact the health of a patient. And I think that our systems are getting much better at this. I think even from the time where I was working in this area to today, there's been a lot of progress in looking at holistic care and looking at a whole patient. And I think continued support and training for our medical professionals to be able to recognize those signs of stress. One thing that we're kind of looking at right now is the connection between adverse childhood experiences, ACEs, trauma, there's different terms for this, and how that impacts individual health. And we know that there are so many chronic impacts on health from early stress and trauma. And I think being able to recognize how that shows up in our own lives and seeking support for that. Patty mentioned that just supports for different stressors. And I think it is important for us to understand how those early experiences are impacting us today and that there are supports and things that we can do, and training our providers to recognize those things and to be able to help us access support, I think is really important. And to me, that's how those things are kind of connected in my own like weird background and experiences. Now I'm working in policy, and I think that's how those are all connected in my mind.
Yeah, absolutely. That's great. Thanks, Lindsay. We did get a question from the audience, and so I'm going to give this one maybe to Dr. Madsen. The question was, any suggestions on how to balance the need for accessible and affordable childcare and paying childcare workers a living wage?
Oh, wow. I wish we all knew how to resolve that.
I know.
The childcare is a market failure, and that's what the research calls it. And in Utah, it definitely is. Some states are worse than others. And on some metrics, we're rated a little bit higher. On some, we're at the bottom of the grouping. But what that means, and I don't have a lot of suggestions other than this, because what a market failure means is that you have that you can't produce services and products that actually resolve themselves. Most people, if they have a product, they're going to make money. In childcare, it's so expensive for most families, even middle income families, not just people in lower income. Yet the people that provide it are often living in poverty themselves. And so that means there's a gap in the middle, and states that have done this well just understand that there has to be an intervention in that gap. And that just means needs to be usually it's public policy, it's state funds, some federal funds. During COVID, we had a lot of federal funds, right? And so in order to really fill that gap, some other organization, whether it's state government, federal government, or whatever, has to be involved. And so that's a tough thing. You want to pay people for their value, and if they're giving quality childcare, and children for us as parents and grandparents are the most important things in life, that we care about, and we want affordable, quality childcare. But honestly, there are struggles with efforts trying to take some of that safety. We want our kids safe too. And so
Right.
there's some really scary things happening that are trying to dismiss that to get more kids in with childcare. So we're just watching some of this in various states, and I'm sure Lindsay, yeah, knows and is watching those as well, and probably Patty too.
Yeah, thank you. Lindsay, did you want to add to that? I saw you had your hand raised.
Yeah, I do. And Susan made some great points that this is like the question, right? Like how do we balance it safe and affordable childcare? How are those things how can we get to that perfect solution? I actually, again, my varied background, I was a licensed childcare provider for actually worked at Sundance Mountain Resort and ran a program there and got licensed and went through the process. And so I will say I've seen some evidence that when you're looking at the safety issue, that there are some regulatory changes that we can make. And again, looking at policy solutions, right? But I remember sitting in a training for childcare professionals, and they said, every law that is on the books, specifically looking at Utah, that regulates what childcare providers must do, for every law, there is at least one or many children who were harmed or injured or killed as a result of an issue, and that's why it exists, right? So these are very important, critical regulations. Oversight is necessary, but when this has been studied, it's shown that focusing on the regulations doesn't improve outcomes. And so there is actually it's better to focus on things like professional development and providing training to caregivers to improve those adult-child interactions. That's what results in better outcomes, and that even changing the child care, the provider to child ratios can have major cost savings. I saw a study where it was like changing it by one infant can have dramatic cost savings, but it does not impact care. And so looking for solutions like that to be able to make sure that the burdens to get licensed and to be able to be a child care provider are not so great that they're prohibiting people to be in this space. And again, that culture shift of making caregiving a viable career choice and making sure that we are giving dignity and honor to caregiving, and that people are motivated to choose that as a career path, that our young people understand that this is a viable option, and that we have people going who want to be there and supporting that, I think is really important.
Yeah, absolutely. Patty, did you want to add anything to that?
Yeah, so I would just bring this scope out into the workplace and say that there are companies in Utah who've done really well with this. Particularly one of them, Qualtrics, would bring people in, talent that they wanted to retain, and say, what are you looking for in a company? What can we do to bring value to you? And one of the number one things of people coming in and also talent from within the state was childcare. And so it's also a retention question, right? I love that Lindsay said dignity to caregiving, like how did we lose that along the way? But also it's a business imperative. It's the value you bring to the workplace of being able to retain your top talent. Because whether or not they have kids, they might have caregiving, they might have other things, but we all touch other people. And so bringing into that workforce lens, I think is really important to gain traction, because you can put policy on the books, but it also has to be enacted and executed. So it's important to take both those angles.
Yeah, absolutely. Thanks for that, Patty. Let's see, I'm going to go back to Dr. Madsen for a minute. You've studied women's leadership across a lot of different sectors. Have you noticed variations in how different industries support or undermine women's health priorities?
You're asking the various industries that do that?
Yeah, in different industries, are there some that are better at supporting women's health priorities than others, or have you found any good examples? Patty just talked to us about Qualtrics, but have you found some other examples of, I guess, organizations that have done a good job supporting women's health priorities?
The industries, there's not a lot of research in Utah that looks at the industry specifically.
Yeah.
There are some industries that are those that in some ways, in other states, those that are more feminine, traditional industries have a little bit more, but on the other hand, usually those industries are lower pay. So they struggle sometimes with these things. But I would recommend people looking at our couple of years of 100 companies championing women here in the state of Utah. So we actually have some reports, and I can put it in the chat for the first year and the second year. We at the Utah Women in Leadership Project have partnered with the Governor's Office of Economic Opportunity, and we're in year 3 now. And some of those things are, you go on as a company or a nonprofit, any kind of workplace organization, and you check boxes. And the boxes that you can check are from extensive research. I've been in this space nationally and globally for a lot of years. And so childcare, of course, is some of those, but leave policies are others. And then just, ERG groups for women, or some of the companies now have ERGs for parents, so you can get together and talk about those kinds of things. And then, of course, other things, Patty knows that part of that is you do training and leadership for women specifically, or send your women to others. All of those things, can I just say, are intertwined. So, and one thing we haven't captured, but I think is important, is to work with your managers, men or women, to see gender differences, because women are different than men, and being able to, what are the concerns that we have as women? What are the concerns as men? And be able to just know more when we're talking and trying to support. I put a resource over in the chat on childcare. What I've heard on childcare from so many companies is that they're scared to talk to their people about childcare, because they assume their people will say, okay, you have to have on site a full childcare center. Well, that is awesome if we can do that. Yet a lot of companies they don't want to go there. So, but there's other things you can do. You can teach your managers to ask questions. You can actually go to resources that are in that publication that I mentioned. There's a lot of things. It's not going straight to the top, but there's all kinds of opportunities and options there. So look at that list. Lots of good companies doing some really awesome things. Overstock is one that we highlighted extensively for not only childcare, but also they would pay to have someone come if you have a little child on a trip, to do caregiving and to ship overnight breast milk. And they have a concierge doctor on there that has saved lives. So all of those things, again, it's not just childcare, it's other kinds of things, having managers that know how to ask you questions and care about them.
Yeah, absolutely. That's great. Patty, did you want to add anything to that? I know you've done a lot of work in this area too.
Patty was smiling. I saw her.
I saw the smile. That's why I thought we were asking.
I'm so excited about 2 things that Dr. Madsen said. First of all, sometimes companies are just scared to ask the questions. Like you asked earlier me about communication strategies. Really, communication, people think that we just have it, we're inborn with it, right? Communication is a skill. And many of our leaders need to be taught how to have these difficult conversations without shaming or blaming anyone, but being proactive. And then the second thing I love that Dr. Madsen brought up was to think outside the box, right? It doesn't have to be the biggest thing, but what is the thing that you can do right now? Instead of exit surveys, maybe you could have one-on-ones, right? With your employees. What do they need? Is it childcare? Is it, a sense of belonging? Is their commutes too long? Can they work hybrid? It's just kind of breaking down that structure and having some flexibility for those on-ramps, those off-ramps. We don't show up the same as men. We don't show up the same every month, right? We have cycles that go in and out like this every single month of our lives, and we're expected to show up the same. So I think that what she just said, I just want to highlight that the conversations are really important to be having, whether that's in your sphere of influence, whether that is a boss or a manager, wherever you're at, just start having the conversations and then build it into the structure of what do your people need and what are some of those low-hanging fruits that you could do, right? Doesn't have to be a big deal, but we all know that confidence and success is built by doing the small things, gaining success in it, and then doing the next thing.
Yeah, absolutely. One of the things that I love that Regents has done is, as part of kind of the HR package, they give us some financial literacy training. And you think about, I mean, financial stress is one of the things that, you know, impacts all of us so much. And so little things like that, just the support systems to have that in place at your workplace. Speaking of financial literacy, I'm wondering, Dr. Madsen, in some of your research, you've obviously identified the gender, the wage gap that there is. Is there anything else that women can be thinking about as they think about kind of their own financial well-being and financial health? Or is there anything else you've identified in that research you've done around wages that would be interesting for this group to hear about?
Yes, can I start real quick though with I actually had a whole course during my master's degree so many decades ago about stress. And
Yeah.
I just wanted to make sure, because I carry quite a lot of stress with what I do, but some stress doesn't have negative health outcomes. Some stress, and the literature calls it eustress, EU, as opposed to distress. So I just wanted to say we're talking and we're assuming with our word stress that everybody feels stress and it's bad. But just to acknowledge, I choose to have lots of things going on because for a couple of years in my life, when I was having a couple kids that are now in their 30s, I actually I didn't have enough to do and ended up into some situational depression because I wasn't able, and I was so much happier and carried so much. I know that I just feel like that's important to talk about because there's a certain amount of busyness and stress that is just helpful. Yet there's a line that we cross, and I cross that often where it is negative stress. And I just want to make sure that negative stress really has been linked, honestly, to so many things like high blood pressure and heart disease and stroke and mental health issues and headaches and body pain and, you know, chronic stress for so many things. So I just want to make sure we're not lumping everything over there. And so just real quick, now that I've spent most of my time talking about.
No, that's great.
I
Thank you for making that point.
Is important. But in the financial one, and we did just release, I believe, just a couple of weeks ago, an update on women in Utah and finance. And women, can I just say, women worry about money more than men, typically. And in fact, we're 37th in the states, so we're in the lower bucket in the difference between worry levels of men and women on doctor visit affordability for us and our families. And so seeing that difference of women and men, and in fact, piece of financial sometimes comes up. We're 46th of states on preventative health care. So women in Utah, compared to most other states, do not do preventative health care. And that's a problem. Talk about leading to more stress, negative stress. And so those things are important. But we're also finding, we see this in high school, that young women and young men have a difference after they finish of confidence and competence, their feelings of competence, not their true competence, but their feelings of competence. There's already a gap in high school when they finish their financial literacy. And so numbers were socialized that women, girls should not be good at math compared to boys. We're one of the biggest states in math scores in 8th grade. That continues on with women really struggling and not thinking throughout their lives that they're good at math, that they can do numbers, that they can do money, that they can do finance. And that results in more stress, often negative stress.
Yeah, absolutely.
I got
Thank
there,
you.
Kim. I got
No,
there.
and that you did. That was very relatable. I took a couple months off in between jobs, and I missed having a certain level of stress. So you're right about that. Lindsay, what am I missing? What else would you feel would be important to talk about in this discussion?
You know, I think we've hit on a lot of really important things. I think I'm, again, always looking at those systemic issues. So I do agree, you know, I didn't really comment on the family-friendly workplace like idea. And I think that there's a lot of really great potential in having organizations focus on that. And I will say from my own personal experience, I am now in an organization where all of the full-time employees are actually women. And I have to tell you, there's a difference. There is a difference in our culture, and there's a difference in our support, such as our leave and our schedules. And I think that my work-life balance is greatly impacted because of it. And that even just that work-life balance, I think that's something that's very related. It's something that's a part of everything we've discussed, but we haven't specifically hit on that. But I think that
Yeah.
is something that we all can struggle with. But having been in this, you know, experience now for almost a year, I'm newer to this position and this culture. But I will say we have unlimited paid leave. And when I first read that in our, you know, the benefits when I was applying to this position, I'm like, that's not real. They don't really mean that. And they do mean that.
Yeah.
And because they trust us to know that the work is getting done. We are all, you know, high contributors. We're all really invested in the success of our organization. And so we will work hard. We work very, very hard. But also, we have that freedom and flexibility to know that our hours aren't being counted in when we need to take time off. And especially for family, we have, you know, the ability to work from home. I think COVID taught us that having that schedule flexibility is critical when looking at caregiving. And when, especially if we're looking at that sandwiching, right? Like looking at older and younger people in our families that we're caring for, that COVID taught us that there are other options, that going into a workplace for 40 hours a week isn't the only way. And I think now that organizations are rolling back some of those flexible work schedule allowances, we're seeing the result in people's satisfaction in their work. And so I think that balance is really, really important. And it's something that we all feel, especially when it gets out of balance. But there are definitely some things I think organizations can do to help improve that ability to find balance in our lives.
Yeah, absolutely. I was sharing with this group earlier that we're making the decision to go back to work part of the time, a couple days a week, but it is so important to still have that flexibility. And Dr. Madsen, I know you did some research on that as well. Can you tell us a little bit about that, about work from home? And
Absolutely. You know, I actually 30 years ago, maybe, did a dissertation on this exact topic, and I have kept up with the research. And my dissertation was on a construct called work and family conflict. So there were questions there. And then telecommuting or teleworking is what I called it. And the research still supports what we talked about, and that is that when you have at least 2 to 3 days where you can be flexible, then you really have lower levels of different kinds of work and family conflict and stress. And so sometimes when you do 5 days, that works well, and these days more with Zoom. But those 2 to 3 days, having that at being able to be flexible, not having to use extra time driving, right? And all of those that you wish you would love to have to be able to get up and start cooking dinner for those people that still cook dinner. I just assemble in my life right now. So assembling is much less time, and I don't have children at home. So bottom line, one of the biggest concerns of mine the last year and a half are companies that are just making the rule to go 5 days back in the office. And mainly that's linked to lack of trust in employees, those kinds of things. It worries me a lot because that disproportionately impacts women's lives significantly more than men's lives.
Yeah, absolutely. Thank you for that. We've got another question from the audience, and I'll maybe whoever wants to take this one can. It's just what are your tips for helping women make their health a priority? So if anyone wants to jump in on that one.
I'll give a quick one. So my
Yeah.
master's degree was in exercise physiology. So I studied the body and the mind body. Most people don't know that I have a master's degree in that. But I will tell you, on days that I'm extra stressed, I feel it in my physical body, and I'm getting older. But I've done this throughout all of my life, is you get out and walk, you hit your elliptical, you can multitask on your elliptical. There's just so many benefits for stress. It's not all about just looking better, right? It is about your physical body and even what happens to your mind when you get out there. Even in my house, walking up and down the steps, all of those things help your body. So lots of other things, but that's the one I'll throw out.
Yeah, I love that. Patty, you had something to add,
Yeah.
it looked like.
I would say just because you can do something doesn't mean you should. So I would say to know yourself, know what's important to you, and everything else say no to. And it's okay to say no. The things that are meant for you will come back around. And I think that stresses, especially many women out, is I've got to take it all on. I've got to be everything to everybody. And if you need permission, I'm just telling you, you don't. You don't need that. So just say no to things.
Perfect. Yes, great advice. Lindsay, did you want to add anything?
The thing that comes to mind for me is prioritizing your own health, right? And that's the question. So as a young mother, I was given a piece of advice that comes up all the time. And it's if you've flown in an airplane, you've heard the safety talk where you're supposed to, if there's an emergency and the oxygen masks drop down, what is the rule? You put your own on before you help someone else. And I think the advice was to apply that to parenting. And it's a very hard thing to do. And as parents, we prioritize the health of our families, and especially if we are dealing, caregivers for multiple generations. But I think just the simple thing of having an annual preventative visit with your healthcare provider, if you can make that a priority, that will help in so many ways, because you're going to be having time set aside to think about your health, to talk to your provider and about any issues. Make a list as things come up, and just hold it. If you can't go in, when you're starting to feel something and you're just like, I can't make it happen, then write it down so you're not forgetting, and bring that to your annual visit. We all are so good at making sure, I know that I guarantee there's people who are like, yeah, I always take my kids to their annual checkups, right? We always go to those. Do you do it for yourself? And if you don't, then try to do that, because that 1 hour or how many ever minutes you get, it could really have great impacts on your health if you're getting connected and you're sharing concerns you have with your provider.
Yes, absolutely. And as someone that works for a health insurance company, I would be remiss if I didn't remind you that most of those preventative measures are covered. And it's just so important to do those regular visits. So thank you for that. We have a few more minutes left, and I wanted to just maybe give you guys a second to think about this, but if there's anything else you wanted to add that we haven't covered yet, well, I take that back. Actually, I'm going to ask another question that the audience just sent, which is, and this is a good topic to make sure we cover. Menopause is a hot topic right now. How can women navigate this stage of life? And I will say that perimenopause is something that I think we're getting a lot of attention on now too, which is good. It was something that wasn't talked about. Is there anyone that wants to take on this menopause question?
I'll mention a couple of resources, and then the others probably would. I just want to make sure people are aware of the effort that we're doing statewide called A Bolder Way Forward. It really is a movement. There's about 6,000 people engaged, 29 county coalitions, lots of leaders around the state. One of our spokes, they're called spokes if you don't know, is health across a lifespan. And we have various topics. And one of those is perimenopause and menopause, right? Another one is reproductive years. And we have great partners. University of Utah Health Regents is a great partner in that space, and also Intermountain. And I have learned just so much from listening to the people that are so passionate about that. So I'm not the one to have, although I'm older and I've gone through and I'm going through things myself, but I've had really good women OBGYNs through the years. Can I tell you that's so important to have? But just wanted to tell you, if you're interested in that we have pages with some resources and so forth, but just want to tell people that that's one thing we're doing. So maybe Patty and Lindsay have some actual tips.
Patty, Lindsay?
Yes, my first tip is no, you're not going crazy. Yes, your hair will grow back. Yes, you will be able to find a full night's sleep again. I just think women are really resilient and adaptable, and this is a space, if you've ever read the book Invisible Women, right? With the research about women and women's healthcare and in the automotive industry, it's up to us to shine a light on these things. So my tip for that is, again, just share your story and ask other people their stories. I love that Lindsay talked about preventative, going in, keeping a list of the things, because if you're anything like me, my doctor's appointments are months out, but I have something that happened. So I just keep a little notebook of all the things I'm concerned about. And some things, like, you just got to let it go. Tell it to your doctor and then say, someday this will be okay. But yeah. My tip. It's going to be okay. And in the meantime, take care of yourself, get a book, and get a good doctor.
Love it. That's great. Okay, now I am going to ask you guys all if there's any final thoughts or anything that we didn't touch on that you'd like to maybe 1 minute wrap up. And I'll start with Lindsay, if you don't mind being put on the spot.
I think there's nothing really that comes to mind. I mean, there's so many things that come to mind, honestly, but in the time we have left, I think it's great that we're having this conversation. I think continuing to prioritize conversations like this and making sure that we're looking at how women do show up differently in our lives, in our world, and really thinking about what we need to be successful, this is what we've talked about today. I think it's important to continue to do that and to examine different ways that the systems that exist that affect our lives can serve us.
Yeah, thanks, Lindsay. Dr. Madsen, did you have any kind of closing thoughts for us?
Yeah, I just want to, I wrote a couple pieces a while back, editorials, or maybe it was a Forbes piece, that talked about, so more conservative religious states tend to have higher levels of sexism. And there's actually research that connects health outcomes and structural sexism and other kinds of sexism too. So just know that when there's more sexism in general, whether it's hostile sexism, which is more aggressive, or even benevolent sexism, that there are more health outcomes that are not healthy. And so even with, I can't remember which one, but there's 3 kinds of sexism that a really great piece was talking about. And on one of them, actually, it had some negative outcomes with men too. And so as we look at what's often invisible in this state, just the way that sexism shows up in workplaces, in congregations, in communities, in homes, can I just say that often? Just know that there are health outcomes, including that are negative, including things that relate to, and I give kudos and thanks to the American Heart Association for being one of the sponsors, and also Cambia Health and Regents as part of that Cambia Health, that are very concerned about the heart, right, issues, as well as and Kim, you're more of an expert than I, but it feels like there's heart health issues in all these things that we're talking about, right? And all the outcomes that we're talking about. So just putting it out there that sexism in general is something we need to work with here to improve women's physical and mental health.
Yes, absolutely. Thank you for that. And Patty, I'll give you the last minute.
Okay. Wow, dropping sexism at the end in my 1 minute.
I know, we didn't even get to get
Dr.
into that
Madsen.
topic.
Okay. That was part of what I wanted to talk about. So here's my example for that, because the invisible landscape, the microaggressions, the bias really does stress women, especially once they start to see it. I'll give you one example. Really talented woman. Her opportunity was to travel with her company. But she was noticing that less and less she was getting to travel. So she went and had a conversation with her boss. Her boss was like, well, you're a mom, so I figured that you didn't want to spend time away from home. That's her career trajectory. That's her opportunity. That's her finances, her promotion. And without even a conversation, he thought he was doing her a favor by not even giving her the opportunity. So those microaggressions are a big stress. And my last thing is, know what your good stress is, the things that motivate you, drive you, and the things that really do impact your health, your sleep, your heart, right? Are you having palpitations? Are you sweating? Like whatever that looks like for you. And when it goes into that bad, I'll start with where I began, right? When it goes in those bad, that pivot, ask for help, find some help, take care of yourself. We need you.
Absolutely. Thank you for that. And thanks so much to the American Heart Association for putting this together and putting this on. One of the reasons it's so important is we know that heart disease is still the leading cause of death for women in Utah. And obviously having less stress and finding ways to prioritize our health is so important. So I will turn it back over to Liv for maybe just a quick wrap up, and then we'll call it a day. Thank you so much to all of our panelists. You guys are incredible.
Yeah, absolutely. And thank you, Kim, for moderating our conversation today. If there were any questions that were asked in the chat or the Q&A that we didn't get to, we will make sure to answer them in a follow-up email. A big thank you to Cambia Health Foundation for sponsoring our conversation today. Thank you all for tuning in, listening, and contributing to such a critical conversation to address the unique stages that women experience, how to navigate stress, and how it all connects back to health. After you exit Zoom, you will see a pop-up to take a quick 1-minute survey. We would appreciate hearing your feedback about today's conversation and any ideas you'd like us to consider for the future. Have a great day, everybody. Thank you.